Hello everyone and welcome to our Neurofeedback webinar. My name is Mona and this is my wonderful co-worker Kristine, and we're both naturopathic practitioners and also certified neurofeedback clinicians here at Total Health. And we truly have the awesome job of helping people like you get their health back on track again using natural medicine. And we're very excited to introduce Neurofeedback to you, as it is a pain-free, a medication-free approach for those of you looking to improve your brain health and brain function. We have found in our clinical experience that many people don't realize that their emotional and physical well-being is very dependent on their brain health. And we find that Neurofeedback is an excellent tool to get people further along their health journey, whether they're dealing with anxiety and depression, focus and attention issues, memory loss, and even chronic pain syndromes. So we are very happy to have you here and participating in our webinar, and we hope that you'll enjoy everything and learn lots. So we're going to get started. So generally when we do these seminars, we ask our audience why they are here. And since I can't do that, I'm going to tell you a little bit about myself and how I learned about neurofeedback and my interest in brain health. So this is me with my mother. She is 81, and my youngest daughter, Georgina. My mother and I both have the ApoE4 gene, and not only one, but 2 copies. This increases our risk for Alzheimer's 15-fold. Matter of fact, we're on the 91st percentile of developing Alzheimer's at some point in our lives. And I did not need to take this test. My grandmother died of Alzheimer's, as did 3 out of my mother's 4 siblings. Now, you can see that we are literally programmed to develop Alzheimer's, but I have to tell you, my mother is doing fabulously. Not only is she still working as a massage therapist, she goes social dancing 3 to 4 times a week, and she's dating a much younger man. And all of these things are just wonderful for the brain. Now, I like to take credit for some of this. I have been working with her for the last 30 years, but more importantly, what I want to tell you is that just because we have a faulty gene doesn't mean that we have to switch on or activate that gene. There is so much that we can do in terms of diet, lifestyle interventions, and targeted brain training like neurofeedback to actually switch off those genes. And we can all do this regardless of what faulty gene we've inherited. So going back to my why, for me it's really important that I don't become dependent on my children someday. I don't want them dressing me or having them to feed me. And more importantly, I want to be able to have as much fun as my mother in my 80s and 90s. So with that, I'm going to turn things over to Kristine, who's going to tell you a little bit more about neurofeedback, the history, and how it works.
Mona, your mom really is fabulous. She's living the dream.
Thank you, Kristine.
Yes. So what is neurofeedback exactly? Well, it's actually a training technique for the brain. So basically, it's a software that monitors the brain for any brainwave irregularities. When one is recognized, a signal is produced to help guide that brainwave back into a more healthy pattern. And done over time, the brain learns to stay within these patterns on its own without the use of software. So essentially, neurofeedback teaches the brain to stay within these healthy ranges by use of a reward system, which I'll kind of elaborate on in a minute. First, I'll go over the different types of brain waves that we're tracking when we do the brain mapping, which I'll talk about in a moment, and just go over what they do and what happens when they're dysfunctional. So as you can see, the 4 are listed here. They're in order of fastest to slowest wave. So beta wave is our fastest wave that we produce, and it's our working wave. So that's most dominant when we are doing tasking, working, critical thinking, that sort of thing. Now, if beta waves get out of balance, we may experience things like anxiety, mind chatter, insomnia, kind of like that feeling like you can never relax. Also, as we age, we can get things like high blood pressure just from elevated beta waves. Alpha waves are the next fastest wave, and alpha waves are more dominant when they're more dominant, we're a little more relaxed. So this is when we can kind of go on autopilot and do a few different things at once. You know, just kind of, it's our creative wave where we think of like, oh wow, that's a really great idea, I'm gonna go do that tomorrow. So that's kind of your alpha mode. Now if alpha waves are out of balance, we can have more depression, more lack of motivation, more melancholy. And then finally we get to the two slower waves. We have theta waves, which are most dominant when we're right about to fall asleep, or right when we're waking up, or if we're in a really deep meditative prayer or prayer state. And then delta waves are most dominant when we're sleeping. However, if there's a lot of inflammation occurring in the brain, we will also have elevated delta, which we'll talk about in a moment. I should back up and say all of these waves are always working all the time, just certain waves are working at certain times versus others. So it's not like when you're sleeping only your delta is working, all of your brain waves are working, but just at a much lower rate. Okay, so now you're probably wondering, how does a computer program teach my brain to stay within healthy ranges, right? Sounds a little sci-fi, Star Trek-y, right? So I'm going to talk a little bit about how that works. Ooh, sorry about that. Before we do any brain training sessions, we do what's called a brain map. And a brain map really gives us an overall view as to how the brain is functioning. So it gives us information such as what brain waves are abnormal, where the location of these are, and also how much inflammation is occurring in the brain. Once we have that information, then we know how to proceed with the brain training sessions. And really the meat of the brain training sessions are something called a frequency protocol. So these frequency protocols are really what teaches the brain to stay within normal ranges. And in our clinic, we have over 50 different frequency protocols that we can work with. So once we have the brain map information, we then can pick certain frequency protocols to help with the training. Now I have some visuals. The frequency protocol is produced by what's called an amplifier. And this amplifier sends the frequency protocol to a stimulus. And in our clinic, we use two different types of stimulus. We use audio or visual. So if the client chooses to do an audio stimulus, they're simply listening to some music on Pandora of their choice with their eyes closed. If they want to do a visual stimulus, they're going to watch something on Netflix of their choice with eyes open, of course. So just as an example, let's say we have client X coming in, they're going to do a visual training session. So what happens is once we have their brain map info, we plug that frequency protocol into the amplifier. The amplifier sends that information to Netflix, and consciously what the client sees is a distorted screen. So it means like while they're watching the show, the screen is flashing in and out, it's getting brighter, it's getting dimmer, as well as the audio portion. So what they're listening to is also very dynamic. It's getting louder, getting softer, and the brain doesn't like any of that. The brain wants to see a clear picture, so the brain gets a little frustrated. So the more the brain pays attention to the show, the more it's engaged in the show, the clearer the picture becomes, and therein lies the reward system. So the brain is actually being rewarded for paying attention to the distortion, which is the frequency pattern, by getting a clear picture. That in a nutshell is how your brain reacts to that. Now as practitioners, of course, we want to know how people are reacting to the training. Because if there is any modifications that need to be done, we can do that. So during a brain training session, we are monitoring them. And typically, the section of the brain that we're monitoring is based on the brain map data. So for example, again, client Z, they're watching something on Netflix and we're monitoring, let's say, the frontal brain. Another visual. I have these sensors here. There's two little sensors. So what these do is they actually go on the scalp. So in our example, these would go on the frontal brain, which is right here. And these sensors pick up how the client's brain is reacting to the training, and it sends that information to a second monitor for the practitioner to view. So in no way are we inputting anything to the brain or rewiring it. We're simply seeing how the client's brain is reacting to the training and then making any modifications if needed. So that again, in a nutshell, is how what a session looks like and how that works. Now, a lot of people think neurofeedback is a newer concept, and it's not. It's actually pioneer days, goes back to the 1890s with a scientist by the name of Dr. Ivan Pavlov. So it's been around for quite some time. But Dr. Ivan Pavlov was kind of the pioneer doctor who did a lot of experimenting. And he actually had dogs and did these reward concept experiments on dogs. Many of you have probably heard of Pavlov's dogs at some point in your schooling career, but just quickly, Dr. Ivan had dogs, and before he'd feed the dogs, he would ring a bell. After a while, he would ring the bell and not feed the dogs. But the dogs still had the physiological response of salivating as if they were going to eat. So that's kind of the pioneer days. Now, if we fast forward to the 1950s, that's really when the bulk of the research kind of took place. We had two scientists that were working independently from one another that were doing these reward concept experiments. Dr. Barry Sturman, who was working out of UCLA, he was working with cats on a food reward system. And then Dr. Joe Kamaya, working out of the University of Chicago, working with humans. More of wasn't food that they were working with, but it was more of like, if you get something right, the buzzer goes off. So anyway, as time went on, the research has mounted, and the technology has evolved to what we now know as neurofeedback. And now neurofeedback is a proven science among the medical community. And really in the past 10 years, we've learned so much more about the brain. And we continue to learn every day, but we now know of concepts such as neuroplasticity, sort of the muscle building ability of the brain, so the more you do something, the better at it you become. And we also know that we can grow new neurons all throughout life, which we previously thought we were born with a set number of brain cells. So all really good news, because we know the brain is very dynamic, and that's good. So I'm going to hand things over back to Mona, and she's just going to talk a little bit about some of the research that's being done today.
So thank you very much, Kristine, for all of that really fantastic information. And just in case there's any confusion, we here at the clinic, we don't use food rewards. So I want to highlight this again because it's really, really important information to understand. And that is that our brains are neuroplastic. That means that we can grow new neurons and make new neuronal connections at any age. You see, as we get older, we actually should get wiser, not lose our minds. And it's almost funny to think that back in the 1990s, as late as 1998, we actually believed that we were born with a set number of brain cells, and once they were gone, they were gone. And we know now that this is not true, and that there's so much that we can do to heal, to repair, and to protect our brains. Now, going back to the slide here, there are over 1,000 studies that have been published related to neurofeedback and its ability to guide the brain back into healthy brainwave patterns. And if you are interested, please continue to scroll on our new website and check out some of these studies and research protocols. Now, neurofeedback, interestingly enough, is being endorsed by professionals such as Dr. Oz, Dr. Amen, and Dr. Mercola. And I'm a really big fan of Dr. Amen. I've read all of his books, all 13 of them, and his latest one called Memory Rescue very much talks about developing skills rather than pills. And he uses neurofeedback in his 7 clinics around the United States to help his clients manage their moods and their minds. So this is an excellent slide that summarizes the things that neurofeedback can actually help us with. As I mentioned earlier, it is a medication and pain-free approach to those of you looking to help for ADD and ADHD, depression and anxiety, insomnia, PTSD and brain injuries, cognitive decline, addiction issues, migraines and headaches, and even pain syndromes like fibromyalgia. So let's look at some of these a little bit closer. So anyone who's had a brain injury or a concussion can benefit from neurofeedback. And one of the things that Kristine and I always do when we have clients is we ask them, have you had a brain injury? And most people, we find, can't remember. But just think back, how many of us have slipped on ice? How many of us have fallen downstairs or fallen out of trees? How many of us have had car accidents or sporting injuries? And the problem with these injuries is that they can cause a cascade of inflammation in the brain that is very, very difficult to stem. And I was reading just recently some very interesting research linking a brain injury with the onset of chronic depression. So keep that in the back of your mind when you go through your symptom picture. Now, anyone who has had a physical or emotional trauma can benefit from neurofeedback. And what I find fascinating here is that an emotional trauma, as much as a physical trauma, can cause brain dysfunction and decreased brain function and other problems down the road. Now, anyone who's had chronic inflammation or disease of the brain can benefit from neurofeedback. And here we're talking about things like MS, Parkinson's, Alzheimer's, and strokes. I don't know if you're aware, but Alzheimer's, for example, is now being called type 3 diabetes or diabetes of the brain. So we know it's directly linked to diet and lifestyle. Now, when we talk about inflammation or chronic inflammation, we're not talking about the occasional pain that you might have in your elbow or the occasional headache that you might have, but we're talking about inflammation deep within the cell, or cellular inflammation. And this kind of cellular inflammation is at the root cause of most diseases that we have today. Now, there are many reasons why we get cellular inflammation. As I mentioned before, it could be a concussion, it could be an emotional or physical trauma of any sorts, but 90% of the time, it is actually directly related to our lifestyle choices. It's the things that we do and don't do in our lives that drive up this inflammation. So for example, if you choose to smoke, if you drink too much alcohol, or perhaps you're using recreational drugs or a cocktail of medical drugs. But even things like sleep, not getting enough sleep, not getting enough exercise, and stress. You know, how many of us are stressed these days? And stress, when we're stressed, we produce cortisol. Cortisol is a hormone that in a high concentration is toxic to the brain. Now, even in these scenarios, neurofeedback can help. Neurofeedback has also been shown to help with ADD and ADHD. Several uncontrolled studies show that with regular training, neurofeedback can improve attentiveness and impulse control, decrease hyperactivity, and even raise intelligence scores. Again, ADD and ADHD are as much neurological as they are psychological, and doctors are quick to prescribe medication, but unlike medication, neurofeedback actually trains the brain to work differently, resulting in significant improvements. Another thing that we have benefited from here in the clinic is that some of our clients are able to reduce or even come off their medication. Now, Kristine and I are not able to help you with that. We are naturopaths, but alongside your neurofeedback training, this is something that you can explore with your doctor. Now, unfairly so, children definitely train much more quickly and effectively than us older folks. You know, once we kind of hit the 50s, the 60s, our brain becomes a little more rigid and requires more training, but we all get there in the end. Neurofeedback has also been shown to help anxiety. You know, it's one of the fastest ways people actually can calm their anxiety. If you're someone like me that has that constant chatter in the brain, whether it's at 3 a.m. at night or all day, neurofeedback is awesome. And one of the first things our clients tell us is that they feel much calmer, that they're not overreacting to stressful situations, and some of them even tell us that they are sleeping better. Neurofeedback also is wonderful depression, as certain brainwave patterns are directly linked to depression. Again, depression is as much neurological as it is psychological, and many doctors actually consider it a state of inflammation in the brain. So when Kristine and I look at brain maps, in particular this one on your left here, we immediately know that this is someone that has an excess of slow alpha brain wave activity in that frontal left cortex. And that gives us clues as to what is going on. This is someone that probably has been suffering from long-term chronic depression, whereas the brain on the right is normal. And this gives us clues as to what protocol or protocols are appropriate specifically for this person so that we can make the best decision for that particular client. So with this, I'm going to turn things over to Kristine, who's going to tell you a little more about this handsome gentleman here.
Okay guys, so I'm hoping, my husband doesn't know that I used this picture in our seminar, and obviously we're doing a webinar, so it's online. So I'm hoping he doesn't watch it, but if you do, Mike, I love you, and thanks for allowing me to take a picture of you while getting a brain map. So anyway, this is my husband getting a brain map. You can see he looks very relaxed. He has a funny looking cap on his head. That's the brain cap that we use to do the brain map. And all the white sensors are picking up his brainwave activity. And what we do is we inject a saline gel into those sensors to pick up the brainwave activity. It takes about an hour. It's very relaxing. And yeah, you get messy, but we glean a lot of good information based on that mess. So first, we're able to see the location of any abnormal brainwave activity. So as you can see in this slide, we have some green and red areas. The greens represent normal brainwave activity, the red areas are abnormal. And actually this is my slide, this is of me, of when I had my first brain map done. And you can see my abnormal brainwave activity is towards the base of the head, which I had no idea why. I couldn't think of anything. And then finally I remembered about 20 years ago, I was in a pretty bad car accident. And to make a long story short, I was temporarily paralyzed for a few hours. So after about 3 hours, I was able to walk again. And I didn't understand how you can be paralyzed one moment and then a few hours be able to walk again. And don't get me wrong, I was very happy that I could walk, but I didn't understand how that happened. So I asked one of the doctors that helped me. You know, I was like, well, how does this work? You know, couldn't walk to get out of the scene of the accident, and now I'm walking around. And he simply told me, you know, your cerebellum got rocked around in its skull when you flipped over in the car, and things were temporarily stunned, and now you're coming out of shock. So that was his explanation to me. The cerebellum being sort of in the mid to back location of the head makes sense. That's what I think my brain map was reflecting. Anyway, I've been working with neurofeedback, and my parietals have corrected, so that's P3 and P4, but I'm still working on my occipitals. So again, when people get their brain maps, we can see the location of any abnormal brainwave activity. Now the brain map also tells us what brain waves are off. So I'm going to be flipping through a few slides just to explain this portion. But the first slide, the global underactivated, represents delta activity as well as inflammation. The middle slide represents alpha, what's called alpha asymmetry, and the last slide represents, or dial represents beta asymmetry. So in a normal, healthy brain, all brain waves are equal except for beta and alpha. So remember, the beta waves are kind of your working waves, and the alpha waves are your more relaxation, creative waves. So technically, your beta should be slightly higher in the left hemisphere, and then your alpha wave should be slightly higher in the right hemisphere. Now, if we go back to these slides, we can see the middle and slide on the far right. So global inhibited represents the alpha activity, which we can see is very low. So it's at about a 1. So that means the alpha activity is staying elevated in the correct hemisphere and is where it's supposed to be. However, if we look at the dial on the far right, the beta activity, you can see it's at a 10, which is poor. So that means in this scenario, that the person is actually producing more beta in the right hemisphere versus the left, which is not what we want. If something or someone is in that scenario, they most likely have anxiety, they might have trouble sleeping, they might have the brain chatter problem. So that's definitely something we look at when we're reviewing the brain map data. Now, the dial on the far left, again, tells us how much inflammation is occurring in the brain based on delta activity. So this is really important because the more inflammation you have, it's going to be harder for your brain to learn and to function overall. So that's one of the things that we help people do, is help reduce that inflammation. Also, we get a client report. Along with the client report, we get a list of supplements that gets generated based on the brain map data. So sometimes it can be long, but the practitioners, we work to refine just a few key things to recommend for people to take, just to kind of obviously help with your brain health. I also want to add, before, when people do decide to do brain sessions after the brain map, we do add a nutritional visit in there because that is so important in helping your brain. So again, if there's a lot of inflammation occurring in the brain, it's usually dietary related, or there's other factors, but a huge piece is dietary related. So we really work to recommend what foods to have and what foods to avoid, and of course talking about the supplements, and that's going to greatly improve the efficiency of the brain, your learning capabilities, as well as you're just going to feel better when your brain is less inflamed. One more thing I want to add before I hand things back to Mona is there are a lot of neurofeedback systems out there, and we utilize what's called the ClearMind system. And what's great about our system is we have access to neuroscientists 7 days a week. We also have a trainer that we work with. So if we need any direction or have trouble with a case, we can always consult with Dr. Suter or Aaron, and we get that feedback, which is really great for us. It's a great perk because, Mona and I are smart, but we don't know everything and we need help sometimes. So I will hand things over to Mona, and she's actually going to discuss some things probably everyone is wondering, and that's how much does this cost?
Thank you, Kristine.
You're welcome.
And we do access our neuroscientist and neurologist on a regular basis, don't we? Okay, so we want to thank you for actually sitting and watching this webinar, and no better way to thank you than giving you a special offer on the brain map. So instead of the normal $197, we're offering you this webinar for, the brain map for $97. And pardon the pun, but this is absolutely a no-brainer because you're going to get a lot of wonderful information about how well your brain waves are working and what you can do immediately to help your brain and support your brain. So this $97 actually includes your brain scan, which is a 1-hour visit. A couple of days later, we have you come back for what we call a report of findings. And in this report of findings, we go over your results in a language that you can understand. And at that point, you can decide whether or not you want to proceed with the brain training sessions. Now, all you need to do is, in the next week, give us a call. Kristine will provide the number at the end, and it is on our website as well. Give the office a call and just make your appointment for the brain map, and we'll get you rolling. All right. So once you have your brain map, you can proceed with the brain training sessions. And as Kristine already alluded to, these are very relaxing. You can watch your favorite show on Netflix or pick your favorite tunes on Pandora. Now, for Kristine and myself as naturopathic practitioners, it's much more than just the neurofeedback training. Kristine already mentioned that we work with you with nutrition, and I'll talk a little bit more to that in just a moment. But we prod you, we nudge you, we want you to do the best you can with these neurofeedback sessions. So alongside the training, we're hoping that you'll make those dietary and those lifestyle changes to bring down your inflammation and to get the most out of your sessions. So going into a little deeper in that nutrition visit that Kristine mentioned, we teach you how to eat for a healthy brain what we want to do is we want to not only balance your body chemistry, but also your brain chemistry so that you can feel good all day long. We teach you what the best superfoods are for the brain, and these are things that you can pick up in your local supermarket. We also want you to know how to keep your gut bacteria happy and that connection with the brain. We often refer to the gut as the second brain, and believe it or not, most of our brain chemicals, or what we refer to as neurotransmitters, are actually made in your digestive system. And in order to have a healthy brain, you must have a healthy gut. And then finally, we also talk about removing harmful neurotoxins out of your diet. And these are things that are right under our nose, in our kitchen, and in our homes, in our bathrooms, and in our laundry rooms. And one of the biggest offenders that always comes to mind is artificial sweeteners. And how many of us are literally addicted to Coke, Diet Cokes, and Diet Sodas? Pretty bad. These are harmful neurotoxins that really, really stress your brain. We've also added something very new to our program. It's called BrainSpan. BrainSpan is a blood spot test, a very easy test that you can do in the convenience of your home. And what it tells us is how well you've been eating to support your brain. Specifically, we're looking at the fatty acids in the brain, the omega-3s and the omega-6s, palmitic acid and arachidonic acid. Now, most of you are probably familiar with the omega-3s, and we know that those are so important in terms of brain health. Those are the basic building blocks of the brain. But most of us don't realize that the standard American diet, the SAD diet, is actually more skewed towards omega-6s. And omega-6s are very, very inflammatory to the brain. So we want to get that balance preferably closer to 1-to-1. And no better way than actually knowing where you are. So when we correct these omega balances, we know that it increases our brain health. You know, it lowers the risk of dementia, it improves long-term memory, we have better focus, we're better able to learn, and it also improves our mood and our feeling of well-being. So improvements are typically permanent, you know, just like we learn to ride a bike or learn a new language, the brain typically never forgets how to function better. And with this, I'm going to turn things over to Kristine, who's going to give you her final words on neurofeedback.
Thanks, Mona. So, you know, we always end on this question. You know, if you have an issue or you're concerned with a family member about their health, and you choose to do nothing about it, where will you be 10 years from now? And that's a pretty important question, and I find myself thinking that a lot lately because one of my dear friends from college had a stroke. She's only 2 years older than me. So I'm 43, she's 45. And actually she had the stroke about maybe a year and a half ago. And she's just learning to walk again. She's walking with a cane, and her speech is really good, but she still isn't working. She has a son and has been out of work for quite some time. She's a single mom. And, you know, I just think as I age, I'm like, wow, I mean, you know, when we're young, we don't think these things can happen to us, but as we age, you know, things start happening where you really have to consider, okay, I need to stay healthy. In my case, again, I'm 43, I don't have any children, and I suspect that my Generation X will have to work into our 70s. So I have to stay healthy to produce and keep working and support myself. But the great news is there's so many things that we can do to make that happen. You know, there's so many things that you can do to turn your health around, given the right tools. So for example, we can choose what we eat. We can choose whether, you know, we go to McDonald's or we have a nice home-cooked meal with good ingredients. You can choose whether to watch TV for 2 hours or take a yoga class online or do a quick exercise in your home, you know, watching YouTube or whatever. We can also choose what body care products to use. So instead of using conventional body care products that contain a lot of harmful chemicals, you can do more natural stuff. And that goes for your cleaning agents, using more healthy cleaning supplies versus using bleach and all those toxins. So there's so much we can do. We can manage our stress better. Of course, we're living in very stressful times and you can't avoid it all, but there are definitely some techniques to manage your stress by. And you can always consult with people like us at Total Health who have the tools to even further your health if you need some help. And neurofeedback is simply one of those things that we provide to help people and kind of teach you how to live and give you the tools to do it on your own. So I really want to thank you for watching. If you are interested or have any questions, you can feel free to call our clinic. Numbers on the slide. Nope, it's not on the slide. There it is. And you can actually set up a 10-minute free consultation over the phone with any of our practitioners, our neurofeedback practitioners, and we'll be glad to answer any questions or talk to you. If you also want to set up a brain map, you can call the same number and do so. Again, for the week, we're honoring the $97 versus the $197 for the brain map. And again, thank you for watching and have a great day.